Hello guys, today I'm just going to discuss about the ethical review procedure by the IRB. In this PPT, I have given some explanation about the IRB, their procedure, protocols, role and responsibility. So one by one, we will just discuss in further PPT. IRB function. The purpose of an IRB is to review research and to ensure the rights and welfare of human subjects involved in research are adequately protected. Why do human research subjects need protection? Trigger events, the Nazi experiment, the syphilis study, the ethical milestone, Nuremberg Code 1947, National Commission for the Protection of Human Subject and Behavior Research in 1974, Belmont Report in 1978, and the Common Rule is 1991. The basic principle of Belmont Report is the respect for the person, beneficence, and justice. Regulatory requirement for IRB approval. Risks to subject are minimized. Risks are responsible in relation to anticipated benefit, if any. Selection of subject is equitable. Informed consent will be short and appropriately documented. When appropriate, the research plan makes adequate provision for the monitoring the data collection to ensure the safety of subject. IRB review of research. All research projects are categorized into one of the three categories for the IRB review procedure. This category is different in level of the scrutiny and submission procedure. The IRB is responsible for making the final decision of which category a research project fall under. Full, expedited, exempted, and research not involving human subject. Full review. One or more committee members are assigned to review the complete protocol or amendment or consent form, investigational drug, device, brochure, and any other protocol material. These primary and secondary reviews summarize the protocol or amendment to the full committee at a convinced meeting and answer questions during the discussion. All the committee members are provided with the summary information for all the protocol covered from the form and informed consent document. This stress the importance of the accuracy and details provided in this document since the majority of voting members only see these two documents. Expedited review. Protocol amendment or continuing review that meet specific federal criteria qualify for an expedited review. The complete protocol, consent form, and any other protocol material recovery review and approval by the committee chairs. Expedited does not mean fast. It is a regulatory term used for the research that must meet a specific criteria. Exempted from IRB review. The committee review is not required for certain category of research activities that involve little or no risk to the human subject. To determine if your research qualify for the exemption from formal committee review, complete the protocol, exemption, review and determination checklist. Only the IRB can make the determination of exempt. This cannot be determined by research. What about the pilot study? Whether or not a pilot study required IRB approval depend on the nature of the data collection in the pilot. For example, we have a study of drug used among with the school student in Kenya. If the pilot study involved the testing the research instrument on high school student, asking them question about the drug use, and this does require the IRB approval. If the pilot involved asking student to give review on the questionnaire design, the content, then this does not require the IRB approval. IRB review and determination of research not involving human subject. There is some research that involve coded private information or this the specimens that do not involve the human subject. When conducting research using data or a specimen, the level of review by the IRB depend on primarily on factors whether the data or a specimen are identifiable to the principal investigator or key personnel. Determination of whether research involving coded private information or biological specimens in considered to be human subject research must be made by IRB, not the investigator. IRB submission packet must include the protocol and any amendment, informed consent, and the investigator brochure. The investigator undertaking CVS can verify the investigator qualification. All the advertising material also required approval. Payment to subject required approval and may be a source of contention between the investigator and IRB. Type of reviews: initial, continuing review, amendments, safety information, or unanticipated problem to subject or others, non-compliances. While review the IRB checks, risks are minimized, consistent with a sound research design and does not unnecessarily expose subject to risk. Risks are responsible in a relation to the benefit. Selection of subjects in a equitable. Informed consent will be short for each prospective subject. Informed consent will be documented. Research plan adequately provide a monitoring the data collected to the ensure safety of the subject. This research plan adequately protected the privacy of the subject and maintain the confidentiality. When some or all the subject are likely to be the vulnerable to poison or the inadequate influence, the additional safeguard need to be included in the protocol to protect the rights and welfare of this subject. How the IRB system work? Primary and secondary reviewers assessment made the 1 week ahead of meeting. Discussion by full committee. Reviewers lead the discussion and everyone contributes. Committee votes, means approve, conditional approval, deferral, and the disapproval. Determining an action. Approval. The criteria for approval are met. Conditional approval. IRB stipulate the specific revision requiring the sample occurrence by the investigator. Then the IRB chair or another IRB members designated by the chair is subsequently approved the revised research protocol on behalf of the IRB. Deferral: substantive clarification or modification required that are the directly relevant to the criteria for approval. Disapproval: major ethical or scientific issues. PI can respond to the IRB or start over. Review strategy, review application. Look for the special issues such as kids, radiations, emergency use issues, new drugs, devices, genetics, storing, and the sample for the future uses. Read protocol summary. Look for site-specific issues can be logistically perform the study here. Read the detailed protocol. Look also at any study-specific tools, letters, aids, and extras. Review strategy. Prepare your comments, write and submit are wonderful. Emailed is even better. Editing the consent form, edit right on the document. Use the legible handwriting and submit marked up document. Background and specific aims. Should contain a convincing summary of the previous work and rationale for the study. Reference should be included. These should be clear aim and endpoint. Subject selection and enrollment. How are subject identified? Add chart, RPDR, referral, PI owns, clinic, support group, and public records. How, when, and by whom are subject for the contracted about the study. Inpatient should be by someone who has reason to know the confidential medical information. Letters should be co-signed by the MD, known to the patient subject. No cold called cold. Subject selection and enrollment. Inclusion and exclusion criteria should be the consecutive list, should include the appropriate laboratory parameters, should include the appropriate medical exclusion, should not rarely exclude non-English speakers, who obtain the consent, who give the consent. Study procedure should include the sufficient detail to ascertain what subject will actually experience while in study. Time commitment, setting or site where the study procedure occur, any routine agents to be used such as the sedation, consent form which detail in later. Risk and discomfort should be listed clearly, quantitatively, and in order of the seriousness. Should include risk of the withdrawal from the current medications, non-medical risk, social, legal, financial, or the psychological risk. Is loss of confidentiality a legitimate of risk or concern? What about loss of privacy? Is there a complete list of adverse events in a drug or device procedure? Any foreseeable but maybe still theoretical risk, for example, tumorigenesis. Benefits. Compensation is not a benefit. If there are benefits to the individual subject, this should be discussed first than any potential benefits to future society. A common error we see is the overstatement of the benefits. Example of good benefit statement: there will be no direct health benefits to you as a result of your participation in this study. Safety monitoring. How are the data to be monitored and by whom? All the study involving more than minimal risk required a data and safety monitoring plan. No, not all study required a DSMB, but if one is necessary, who does it involve? Is it depending? Should it be? Are there objective criteria for withdrawal of subject when safety is in question? Are these stopping rules? Is there a plan for reporting to the IRB? Common review issues. PI has failed to provide the information about the reasonable clinical context or apparent withholding of standard of care, failure to minimize risk, and adequate information about the collaboration site, especially when international sites are involved, poor preparation of the material, cutting and pasting and errors, poor writing skill, no proofreading. References. These are some references where I have taken some points in this PPT. If you will face any problem while reading this PPT, I am always free to ask me any question. Thank you.